specific of a question, but why would we want to go to a more sophisticated measurement system?
Yeah.
What would be an example where it's not cutting it just to say, look, you're going to do the same thing. You see the fifth med is plantar flexed, the foot's in a verum position, and you just got to do an offload the fifth med. Why do you need a $7,000 unit?
Sure.
And that's a very simplistic type of approach. However, there might be some more nuanced clinical questions to answer.
Absolutely, and one of the things is people normally ask me, oh, we gait analysis. The first thing to do in gait analysis is see someone walk. My eyes is my best judge, and I can see my patient walk, and I can judge whether they've improved or not improved. Yes, you could, but the main thing is about using the technology to do repeatable measurements. So your patient walks in, you do some clinical assessment, you make notes, but can you communicate that notes, which is in your brain, because it's in your eyes, you know what that patient looks like, and you know what that patient has. It's about you communicating it to your colleague who might end up seeing the same patient in a few weeks' time because you might be on a holiday. If that's the case, it is about objectivizing the data. So if you could support your clinical decision based on the data, then it becomes easier. That's where you need technology. So when I talk about technology in terms of gait analysis, it's not about complicated optoelectronic systems or complicated camera-based systems. It is about you could use a pressure walkway. It is about the type of patient. It is about what outcome measures you want to use. As long as you have data which can support your clinical decision, and many times it is about that technology that you use. If you use appropriate technology, and if you could make appropriate measurements, and this is where we talked about last time, it is when we use the technology, it's appropriate use of technology too. And we'll come back to that in a minute. I guess when we talk about pressure measurement, and one of the common things that I see all the time when I travel around the world is the calibration of pressure system and the use of pressure systems from various vendors and various technologies. So it is about using appropriate technology, which would support good quality data, repeatable data, reliable data, which can be stored so that you could see the care pathway for that particular patient. And also it helps you communicate it to your colleagues and to the patient. Does that make sense?
Yes, makes great sense. And, several ideas come to mind. One, and I don't know if it's a company that you might have been familiar with, but this might have been in I want to say the mid-90s. There was a Canadian company called Footmax, and they tried their own version of a pressure mat. Only problem was it was a small mat, and you literally had to game your gait to step on the appropriate point. And as you know, and some of the viewers might not know, the more sophisticated gait labs, it's a random thing. It's under, and it's like it's on a mat, a flat runway, and you don't even know where the mat is, which is perfect because you can't just like, okay, let me get to that step and place down.